Hi, my name's Zach. I'll be your nurse practitioner today. To start off, can I get your name and date of birth?
Betty Alexander, 11/17/60.
Then I see you have someone else on the call here. Can I ask who that is?
This is my
I'm Veronica, I'm her daughter.
Okay, are you okay with proceeding with your daughter on this call?
yes.
Okay, and then what brought you in today for this video call?
Well, my body's been hurting a lot more lately.
Tell them about your depression and not being able to do a lot. She stays in bed all the time. She doesn't sleep very good lately. Once in a while, she'll complain about headaches happening. She just is definitely more painful and just not her normal self.
Do you have any other medical conditions I need to know about to start?
I have lupus.
Okay. And then you said you had pain, and did you have any stiffness as well with that?
Mhm.
And then with that pain, out of 0 to 10,
She's
10 being
always
the worst,
complaining that she's constantly in pain.
what would you rate your pain at?
I would say it's a 7.
Then whereabout on your body is that?
It's in my hips, my legs, my arms, my back. I get headaches a lot.
And then is there anything that helps with that pain?
Just rest, Tylenol,
Is there anything that makes it worse?
movement when I get up and do stuff. So I haven't been doing a lot around the house lately.
Yeah,
What
us
would,
kids have been over there quite a bit lately. We've been cooking her dinner and cleaning, and my kids, they love their grandma, so they're constantly up her butt too, and she just can't play with them like she used to.
and then what would you say like the duration of that was, the time of that pain as well too?
It's been going on for a few months, but it's constant.
Have you been experiencing any fatigue with that?
Mhm. I stay in bed a lot.
Do you have a history of diagnosed depression and anxiety as well?
I have been diagnosed with those.
She's on some meds for it, and it's been controlling it. She's been on like Effexor for it. She's just been happier, but the pain I think is worse now than what it was before.
And I know you said you're having a hard time sleeping. How many hours a night would you say you're getting, and what would you say the quality of that is?
Well, I only get a couple hours of sleep, but I wake up a lot. It's hard to stay asleep.
Okay. Judging from those, this sounds like it might be fibromyalgia, possibly. In order to fully ensure this, I'd like to do some more tests with that. Do you have any questions on the test that I'd be doing?
What type of tests are we doing?
We recommend getting a complete blood count, erythrocyte sedimentation rate, a rheumatoid factor, and a thyroid function test. Pretty much all of these are just given in order to ensure that we got the right diagnosis and are actually giving you the correct treatment, and it's not something else causing this issue, and it's really what we need to be doing. Do you have any questions on potential treatments?
Well, how do we treat this?
There are 3 FDA approved medications for fibromyalgia that you could choose between. Cymbalta, Savella, and Lyrica are the 3 that are the FDA approved for fibromyalgia. Do you have any questions on these?
How will I feel on it, and what do they do?
So each of these medications are SNRIs, which are serotonin and norepinephrine reuptake inhibitors. So pretty much what this does is it changes the chemical balance in your body in order to reduce the pain of fibromyalgia by reducing serotonin and norepinephrine. These take a couple of weeks usually to take into effect. They have to be on a specific schedule and need a good medication regimen in order to be effective. You can have some side effects such as weight gain on Lyrica, maybe a little bit more sleepiness. Any of these medications you're recommended to not take suddenly, and you should let us know if you're having any signs and symptoms of seizures or a increased risk for suicide as well with those.
I mean, because she has depression, do you think any of these meds are good to be put on for her to be on?
These should be able to be taken with depression medications. SRNIs are sometimes used for depression as well. They're
Okay.
similar to SSRIs, which is something you had mentioned.
Okay.
Do you have any questions on any of the
So right now
referrals?
she's been taking a lot of over-the-counter medication, and she's been doing a lot of ibuprofen. Is that okay still, or?
Over-the-counter pain medications are okay to take. Acetaminophen and ibuprofen can both be taken. The only thing to watch for with ibuprofen is it's a drug category that can cause some stomach irritation from long-term use. So we more recommend acetaminophen, but with that, you have to watch out because you don't want to take more than 4,000 milligrams in a day, as it could become toxic to your kidneys. And if you have any kidney issues,
So
is there what?
Can she be put on any narcotics then, or opioids?
We tend to avoid doing those as they cause sedation and dependency and don't truly treat the pain that the patient's experiencing with fibromyalgia. The important thing to look for with NSAIDs is the kidney function. If you have any kidney issues, you're going to want to avoid taking those as well.
Okay.
Did you have any questions on any of the type of specialists you may need to visit?
Who will I be sent to?
So I'd like to send you to a pain specialist. They just can more effectively treat your pain. They can give you a more directed method. Your primary care provider should be notified of this as well in order to have them collaborate treatment with your daily checkups and continued checkups for the future. Internist could be recommended, or rheumatologist, in order to more directly deal with that specialty, as those are two specialties dealing with condition functions and how to treat them properly. There's other therapists that could be used, physical massage and alternative therapies as well.
Okay.
Would you say this has been affecting your daily living extensively? Anything with spirituality or your cultural effects?
I just don't know why God would let me hurt like this.
So with that, it's important that we still try to maintain your spirituality and get you a good support group in order to feel supported and help with both your depression and your new diagnosis of fibromyalgia. This can be difficult on patients and affects their daily living. The important thing to know is that it's non-life threatening. It may cause changes to your life, but it isn't threatening to your actual life. So.
Okay.
And as I see, you got your daughter here
Is there
too.
anything else we should really be worried about with her then?
With her, you just want to avoid the worsening depression. Make sure she's still having her daily living. It's important that you get encourage physical activity and that the family is supportive of her as well. And even if you guys have a hard time staying up with her and doing the need anything that she needs. There's support groups as well that she can go to in order to talk with other people that have this condition to feel more included in a more holistic approach.
Okay. Do I have to worry about anything about getting this or anything?
Fibromyalgia does have genetic risk factors. So it's important that you follow up with your primary care provider in order to ensure that they check on your yearly screening in order to see if you're having any issues with this so you can get treatment as well. With her, it's important that you're more flexible with your mom in this time. You should communicate openly with her. You two should be able to talk openly about your concerns in order to kind of promote a better relationship for the condition. Physical activity is important. And then both of you can join a support group as well. They have support groups for people with fibromyalgia as well as those for caregiver. Caregivers can often have a lot of strain with this new condition. Do you have any final questions for me?
I don't think I do.
No.
Okay, well, it was nice meeting you. I hope you have a good day. Bye.
Thank you.